a team of Danish scientists has published evidence in the European Spine Journal that many sufferers could be cured by a course of antibiotics. Well, with me is Dr. Hanne Albert, who's part of the Danish research team who made this discovery, and it is a real breakthrough, isn't it?
It is a tremendous breakthrough. We've never had a disease where we could be so specific about the MRI's finding, the physical examination, and the patient history. And what is extraordinary is that this back pain is caused by bacteria. And then when you have bacteria, then you can fight it with antibiotics. It's a long cure, it's 100 days, and it takes a long time to heal afterwards. But after, then you have these patients who are the most severely affected.
We're talking about chronic back pain.
We're talking about chronic pain. These patients have pain 24/7. 70% of them cannot turn over in bed at night without being awoken because it is so painful. And they are out of work and out of life.
And antibiotics might be able to help them. Tell us a little more about how bacteria get into the back, into the vertebra. I just don't quite understand.
No, I can understand that. The thing is that when you have a slipped disc, you have some material goes out, and around this you have a new capillary system with blood, little blood vessels. And when we brush our teeth, we have bacteria in our mouth, something called probiotic acne. And when you brush your teeth, we do that at least twice a day, you have bacteria coming out into your bloodstream, and you can take a blood sample, and for the first 10 minutes after you brush your teeth, you will find bacteria, and they enter the disc due to this new capillary system which is there when you have the slipped disc, because normally the disc is closed and you're unable to enter it.
When the disc is slipped, the bacteria can get in and then inflame it.
Yes, and you have an infection, and the infection, it is like if you have a splinter in your finger, you have an infection, and around it is the edema, and the edema is what we call the Modic changes, and they are the ones who are painful.
It sounds as if your findings are something that doctors should take on board right now, because from a blood test you'd be able to tell whether these bacteria are present.
No, not by what. No, unfortunately, nothing is really that easy.
How should it change the way that patients are treated now, though?
We should. The people who have Modic changes, they have long-lasting back pain. You can see they have Modic changes on an MRI. And if you go to our website, massmedical.com, the doctors can find, this is the findings when you examine the patient, and there's a very typical pain history. And patients can also go to our website and see, there's a little test, do I fill in yes or no? And then find out, do I have Modic changes or not? Because it is not to be given antibiotics indiscriminately. It's not jelly beans that we're handing out. It has to be given to this very special subgroup of low back pains, but the ones who suffer the most. And they are the ones who are the most important.
And for them, there is now an easier cure, a much easier cure than major back surgery.
Yes.
Hanne Albert, thank you so much for coming in to speak to us.
It's a pleasure.